Dr. Sam, and we are here with Ben Gray, who at the College of GPs conference in Auckland 2016, and Ben is receiving his Distinguished Fellowship. So Ben, what's been your journey to get to this point?
Well, I started out, well, we won't start when I was born. I started out in general practice in Waitara.
Yeah.
I had my first house job in New Plymouth and did my GP training in Taranaki. And interestingly, I took the first professor of general practice for a tour around Taranaki when he was first appointed.
Oh wow.
So my practicing life spans academic general practice from when it began until now.
Yeah.
And so I did that with Keith Carey Smith in Stratford and really enjoyed it. And then I decided I needed to practice, and so I went to the only practice in town and said, "Oh, do you need a new partner?" And they said, "Oh, that's funny, we're just rebuilding. We're looking for more." So I worked in Waitara, and that was an amazing experience for reasons which in retrospect weren't particularly medical, but which were all about being involved in the community. So I got really involved in the Waitangi Tribunal hearings that happened in Waitara, which we now know was a really important turning point in New Zealand history, and I was there at the beginning, and I mean another little thing, so I was the doctor for the centenary of the Sakio Parihaka, because I was involved in that community and they needed a doctor, so I went and flogged a whole load of things from ED to put into a caravan, and so that was really where I started my general practice journey, and it was really nice being in a small community, and the sense I had was that I had a role in this community to try and make things better than they otherwise might have been.
And you belonged, and you were grounded.
Absolutely that.
That's great.
So that was really great. And then I was originally from Wellington, and I met a woman who lived in Wellington. So she did move to Taranaki for a while, but we then moved down to Wellington, and I've been living here ever since.
Cool.
And then I did 6 months of childcare until it was driving me mad, and we both decided I need to go back to work. And I went to work at Newtown Union with my classmates, Don Matheson, Julia Carr, and Kathy James were there.
So that was a little bit of time ago?
That was 1992, and they had set Newtown Union up. At the time, it was not a popular place. The NZMA had taken them to court over not passing on fees. The local community, medical community, ostracised us. It was a pretty tough time, but they were doing some really exciting things in terms of looking at new models of care, which I can now see were miles ahead of our time. And actually there were a number of college conferences where they'd bring in speakers from overseas describing what we were doing. So that I can remember there was one who was saying, look, well, you need to actually have a goal for the practice, a mission statement, because if you don't know what you're doing, how can you measure the quality of what you're doing? Well, we'd had one of those since we set up. And similarly in terms of working with nursing staff to the top of their practice, same sort of thing that we've done. So a whole range of things that we did really well. And actually my one regret is that I did not get a job at university sooner, because had I done that, I would have got involved in evaluating and writing up the stuff that we've been doing at Newtown, which never happened to a great degree. And so we lost some of the things that we developed because it wasn't developed in that sort of way.
And I think there's probably a lot of practices around the country that really could shout a bit louder about what they're doing, because we're all doing things that are really fantastic, and it's great.
Well, and I think that issue of what is practice, and I'm now firmly of the view that you cannot be a real practitioner unless you're doing both, obviously practice, but also teaching and research, because you need to be questioning, what am I doing and why? Or if this is working well, how do I know it? I think it's good. How do I know it's good? Let's do an evaluation and publish it, and then see what other people think. And it may be that what you're doing is actually brilliant, and if other people knew about it, they would then proceed. I mean, the one area of practice I really regret we didn't do much sooner was that we employed midwives on our staff. One of very few practices to do that, and as a model of integrating primary care, it's a no-brainer, and the rest of the country does independent midwifery separate from general practice, and it's really quite fragmented. And it was a brilliant program, it's just that it wasn't funded, and we were subsidising the funding of the midwives from the pot. And so when we had our budget cut, we had to fire our midwives, and so we don't do that anymore. And I understand the same's about to happen out at Pororoo Union, who also haven't been employing midwives and are also faced with another budget cut.
Yeah.
So there are things which, if you don't
Yeah.
do the evaluation, the good things you're doing don't get learnt by other people. So that was a really important part of it. And then I got a job at university.
Yeah.
I mean, I started doing a little bit of part-time stuff. I had a year's break because my wife wanted to do some study in the States, and when I came back I thought, actually, I'd previously done a lot of patient management stuff, practice management stuff, and I can do that. I don't really like it. And so there was vacuum when I got home, and I thought, maybe I'll go there.
Yeah.
And I got lucky in that the university, there was a post that came up, and I didn't have any other qualification other than my general practice qualification, and I was probably one of the last people able to be appointed without any postgraduate training and or promising to do a PhD in your first year. So,
but you have been doing some research now.
Oh yeah, well, so and then what happened was that I ended up convening professional skills, attitudes and ethics because the person who'd been doing that left. Because she was only on a yearly renewed contract and she was over it, and I never learnt professionalism. I didn't know what it was, so I had to find out about that. And what I found was that I didn't like the way they were teaching ethics in the undergrad, in the Dunedin program. And to be able to critique that and address it, I decided I had to do a master's and find out what I was talking about. And so I did a master's in bioethics and health law.
Oh, cool.
Which was absolutely brilliant fun and has moved me in a whole load of directions that I never would have expected. But incredibly relevant to, and actually built upon the experience that I had in Newtown. And I guess the Newtown experience, I haven't talked any personal detail about that, but it's an incredibly ethnically and culturally varied practice, which has taught me just a huge amount.
And you've been doing some research into interpreter use and those sorts of things as well. So tell us a little bit about that.
So Newtown was probably one of the first practices to actually get some government or some funding to pay for interpreters. And this was because the DHB at the time had some money to put into projects, and we took on caring for refugees, and we said, well, we can't look after them if you don't give us some money for interpreters. And so we started employing interpreters and getting the skill of how to use interpreters and understanding how to use interpreters. And so we've probably, I personally have probably been working with professional interpreters as long, if not longer, than any other doctor in New Zealand, any other GP. There'll be exceptions, and someone will be writing in right now, I'm sure. You too, right. But you know what I mean. So I mean, there were not many doing that work. And so that when I came to the university and was looking, so what research am I going to do? I mean, it was screamingly obvious that this was an area of expertise that I had that wasn't widely shared. And so we've done a whole range of things in terms of video recording interpreted consultations and analysing them, developing a training tool for medical students on working with interpreters. And we currently have a project, thank you, College of GPs, funding me, to develop an e-learning module for practitioners, for GPs and practice nurses, primary care people, on how to work with interpreters. And I then also did a whole load of work with the last edition of Cornerstone and worked with them to say, look, actually, if you read this Cornerstone document you currently have through the eyes of someone who doesn't speak English, there's a few holes here. And so actually going through that in some detail, and they were very open to that, it was just they would have thought about it, meant that we were able to shift that. So that whole work is something I'm really, really keen and passionate about. And on a sort of global level, I mean, the challenge we have is how we live with diversity. That we are increasingly diverse over the whole world, and it's how we manage that sort of stuff, which is actually how well we're going to survive in the next, century or so. And so I'm working at the microcosm of that. But with a view to the macrocosm, to the practice-wide things, to the country-wide things, but the same principles apply internationally.
Oh, that's great. Well, congratulations on your Distinguished Fellowship.
Thank you so much.
And I hope things go well for you, and that we look forward to more research coming out of your obviously keen academic career. So thanks very much, Ben.
Thanks, Sam. That's great.
Okay.